All right, this week we're doing something fun. We're talking about common myths about TPLO surgery. Naomi's helping with this. She's got some common myths that we've been asked a lot. Okay, the first one is that only big dogs need to have TPLO surgery, and this just isn't the case. It's based on a study that showed short-term dogs with surgery versus not having surgery have similar outcomes, especially as they get a bit smaller. Doesn't take into account a whole bunch of things though, and really your pet needs to have an individual assessment made about its needs, its level of comfort, and also the expected levels of activity afterwards, so that we can make the best decision for your pet. Next myth, well, this is the opposite. This is the fact that every dog needs to have surgery if it's ruptured its cruciate ligament. And again, I think this one's probably not true. There's certainly a cohort, there's a group of dogs, very little dogs who aren't very heavy, who probably don't have very high activity levels, will see similar outcomes with and without surgery. Much older dogs who aren't very active anymore and don't necessarily need to have a fully functioning cruciate ligament also may not be good surgical candidates. What we find over time is once they rupture their cruciate ligament and we deal with the initial pain, a lot of scar formation will occur and the joint capsule will get thickened and provide some stability to the knee. And in a lot of cases, this may be all your pet needs. Like most things, it's really important that an individual assessment is made for your pet and we make the right decision moving forward. Our next one is that it's a very painful procedure and that dogs are in a lot of pain afterwards. Now, the TPLO procedure certainly involves an osteotomy. We're cutting through some bone, and so there is some initial pain. Here at Galley Veterinary Hospital, all of these dogs have local anaesthetic placed into the joint after the surgery. They're on intravenous rates of constant pain relief, and we care for them here in hospital, making sure they're really comfortable. For most of our dogs, by the time they're going home, they only need some oral anti-inflammatories and maybe some other drugs. We're looking after their pain really well. So I don't think you need to say no surgery just because you're worried about the amount of pain your pet might be in afterwards. In the long term, your pet's going to be much more comfortable. Our next myth is talking about the cost. So saying that it's a very expensive surgery and it's not worth it. So I've got a couple of things to address here. And the first is that, just like I was talking about a minute ago, is the amount of pain these pets are in. Chronic arthritis, chronic instability in the knee leads to a lot of pain. And I think that that's always worthwhile fixing and being able to do something about. Also, when we correlate, when we compare the cost of coming in for arthritis treatment for years and years and years compared to the cost of surgery, I don't think there's going to be much difference at the end of the day. And so that's one of the reasons why in a lot of dogs I still recommend the surgery really happily, because I know their long-term outcome, their long-term comfort's going to be much better, but also I think that the owners are going to spend less time coming into the clinic with their pet. The last one is that the pet will just rupture the ligament again and we'll have to do the surgery on the same knee again and again. This one's completely false. And the reason for this is that it's based on a couple of things. We do know that dogs that rupture one of their cruciate ligaments have about a 60% rate of rupturing their other cruciate ligament. But what we know is the way we fix it in dogs, where we do an osteotomy and change the angle of the bone, they can't redo this damage. So it is very much a one and done. Once we fix it, and we get them walking again, they cannot re-rupture the cruciate ligament after a TPLO surgery. Thanks, guys.